Imagine this. The clock strikes midnight and the house is shrouded in darkness. A figure rises from bed, eyes open but unseeing. They navigate their surroundings with an eerie familiarity, their movements mechanical and detached. This is sleepwalking, a fascinating and often unsettling sleep disorder that affects millions worldwide. Sleepwalking, also known as somnambulism, is a sleep disorder characterized by complex behaviors performed while asleep. It's a journey into the depths of our subconscious, a nocturnal adventure that can range from mundane to downright dangerous. This essay delves into the intriguing world of sleepwalking, exploring its causes, symptoms, impacts, and potential treatments. We'll unravel the mysteries of this sleep disorder, shedding light on its historical context, scientific underpinnings, and the latest research aimed at understanding and managing this nocturnal phenomenon. Join us as we embark on a captivating exploration of sleepwalking, a journey that promises to be both informative and enlightening. This image captures the essence of sleepwalking, highlighting the mysterious and often unsettling nature of this sleep disorder. The silhouetted figure, caught in the act of sleepwalking, evokes a sense of intrigue and curiosity. The darkened room and the lone figure standing by the window create an atmosphere of mystery and suspense, drawing the viewer into the enigmatic world of sleepwalking. Sleepwalking is a sleep disorder that involves engaging in activities typically associated with wakefulness while sound asleep. It's a non-rapid eye movement sleep parasomnia, meaning it occurs during the deeper stages of sleep. Sleepwalkers may walk, talk, eat, or even drive, all while completely unaware of their actions. This phenomenon has fascinated and perplexed humanity for centuries. Ancient civilizations often attributed sleepwalking to supernatural forces, believing it to be the work of spirits or demons. Historical accounts of sleepwalking are rife with tales of bizarre and sometimes dangerous behaviors. One famous case involved a young woman who, while sleepwalking, would write poetry with a level of skill and creativity she didn't possess while awake. Another notable case involved a man who, in his sleep, walked out of his third-story window, miraculously surviving the fall. These captivating anecdotes, while intriguing, highlight the potential risks associated with sleepwalking and the importance of understanding this complex sleep disorder. This image, reminiscent of historical depictions of sleepwalking, emphasizes the long-standing fascination with this sleep disorder. The illustration's vintage style transports the viewer back in time, highlighting how sleepwalking has been a subject of curiosity and intrigue for centuries. The sleepwalker's vacant expression and the open door in the background hint at the potential dangers and unpredictability associated with this nocturnal phenomenon.
Sleepwalking is often a multifactorial disorder. While genetics lays the groundwork, environmental factors and underlying medical conditions can act as triggers, increasing the likelihood of sleepwalking episodes.
The causes of sleepwalking are multifaceted, involving a complex interplay of genetic predisposition, environmental triggers, and underlying medical conditions. Research suggests that sleepwalking tends to run in families, indicating a strong genetic component. If a parent or sibling sleepwalks, the likelihood of other family members experiencing sleepwalking increases significantly. This suggests that certain genes may make individuals more susceptible to experiencing this sleep disorder. Environmental factors can also play a significant role in triggering sleepwalking episodes. Sleep deprivation, stress, anxiety, and disruptions to one's sleep-wake cycle can all increase the likelihood of sleepwalking. Certain medications, such as sedatives and some antidepressants, have also been linked to an increased risk of sleepwalking. Furthermore, medical conditions like restless leg syndrome, obstructive sleep apnea, and certain types of seizures can contribute to sleepwalking episodes. Dr. Patel emphasizes the importance of a comprehensive evaluation to identify and address any contributing factors. This image provides a visual representation of the brain activity associated with sleepwalking. By highlighting the specific brain regions involved, the image helps viewers understand the physiological underpinnings of this sleep disorder. The diagram emphasizes that sleepwalking is not merely a psychological phenomenon, but rather a complex neurological event with identifiable brain activity patterns. Sleepwalking can manifest in various ways, from simple actions like sitting up in bed to more complex behaviors such as walking, eating, or even driving. Episodes can last from a few seconds to half an hour or more, and the sleepwalker typically has no memory of the event upon waking.
Diagnosing sleepwalking involves a thorough evaluation of the patient's medical history, sleep patterns, and any potential triggers. Polysomnography, or a sleep study, is often used to monitor brain activity, eye movements, and muscle activity during sleep.
Identifying the symptoms and obtaining an accurate diagnosis is crucial for effectively managing sleepwalking. By understanding the underlying causes and triggers, healthcare professionals can develop personalized treatment plans to help individuals minimize the risks and impacts of this sleep disorder. This image illustrates the typical symptoms and diagnostic process for sleepwalking. By providing a clear visual representation, it helps viewers grasp the complexity of diagnosing and managing this condition. The image underscores the importance of a comprehensive approach to understanding and treating sleepwalking.
Living with sleepwalking can be, well, quite challenging. You never really know when it's going to happen, and that unpredictability can be stressful. I've had to take extra precautions like locking doors and windows to ensure my safety.
For many, sleepwalking impacts not just the individual, but also their family and loved ones. It can lead to disrupted sleep for everyone in the household, and sometimes even injuries.
Yeah, it's definitely a team effort. My family has been incredibly supportive, but it's hard on them too. They worry about me, and sometimes they lose sleep over it.
Despite these challenges, many sleepwalkers find ways to manage and adapt, making sure they can still lead fulfilling lives.
Treating sleepwalking often involves a combination of strategies. We look at improving sleep hygiene, addressing any underlying conditions, and sometimes medication may be necessary.
It's important to create a safe sleeping environment. Removing sharp objects, locking doors, and using alarms can help prevent injuries.
Cognitive behavioral therapy can also be effective. It helps in reducing stress and anxiety, which are often triggers for sleepwalking episodes.
Consulting with a healthcare provider is crucial. They can tailor a treatment plan specific to the individual's needs, ensuring the best possible outcomes.
Research in sleepwalking is continuously evolving. We're exploring the genetic factors that may contribute to the condition, as well as new treatment modalities.
Advances in technology like wearable sleep trackers are providing new insights into sleep patterns and behaviors.
These tools are helping us understand the complexities of sleepwalking better and could lead to more effective interventions in the future.
Collaboration between researchers, clinicians, and patients is key. By working together, we can uncover new ways to manage and potentially cure sleepwalking. Sleepwalking is a condition that affects many, but with the right knowledge and support, it can be managed effectively. If you or someone you know is experiencing sleepwalking, don't hesitate to seek professional help. Stay informed, stay safe, and take action. With continued research and awareness, we can make strides toward better understanding and treating sleepwalking. Thank you for joining us on this journey.